Hi, my name's Carly Lever, and today I'm going to be talking about a few diseases of the nervous system. So, the topics I'm going to cover today are Parkinson's disease, multiple sclerosis, and repetitive head injury syndrome. So, the first article that we're going to be looking at is about Parkinson's disease. It covers a few topics, mainly what it is, pathophysiology, signs, symptoms, treatments, and outcomes. I decided to choose this topic because my grandma actually suffered from a disease similar to Parkinson's. It was more advanced, but I couldn't find much literature about that, so I decided to study this instead. It's a pretty interesting topic. So Parkinson's disease is a neurodegenerative disease, and it mainly impacts people in the 6th or 7th decade of their life. Fun fact, it affects 2% or more of people above 60 years old. It's characterized by a unilateral onset of resting tremor, rigidity, or bradykinesia. There are numerous factors that can contribute to Parkinson's. One of them is just as we get older, 70 to 80% of the 450,000 dopamine-producing neurons die. Another cause is the neurotoxin MPTP. It can be accidentally made during MPPP manufacture, which is a synthetic opioid. You can also find it in the environment, and it causes destruction of neurons. There's also a genetic component. You can be more susceptible just due to your genetics. We see this in Asian and African populations as they have a much lower prevalence of Parkinson's. We've also seen it in twin studies where identical twins, whether raised together or separately, have about the same incidence of Parkinson's. In order to diagnose Parkinson's, a patient must exhibit 2 out of 5 symptoms, being tremor, rigidity, bradykinesia, postural instability, or freezing. One of them has to be tremor or bradykinesia, though, to make the official diagnosis. Also involved in the diagnosis is you have to make sure that there aren't any drugs causing the symptoms, because there are 3 classes of drugs and 4 specific drugs that are known to cause Parkinson's. So there are 5 known steps when it comes to treating Parkinson's. The first is to consider neuroprotective therapy immediately. The second is to administer dopamine agonists to control the symptoms. The third is to add levodopa, which is a drug, if the agonists aren't really working. Number 4, use a COMT inhibitor with the levodopa. And then 5, if all options aren't working, to consider surgery. I've also included a few diagrams here on the slide that this article didn't cover that also is pretty important when it comes to Parkinson's. So the second article I decided to cover is all about multiple sclerosis. So I don't know much about this disease, and I've always heard a lot about it, people referencing it, and I never truly understood what it was all about. So that's why I decided to research it a little bit more in depth. Multiple sclerosis, which I'll probably refer to from now on as MS, is an autoimmune inflammatory disease of the central nervous system. It's a disease that destroys the myelination and axons of the neurons in the brain. So myelination is that fatty outer layer on a neuron, and that runs along the axon, usually speeds up signals. So a little bit of an interesting fact is that MS affects 2 times more women than men. So for every man affected, there are 2 women affected, which is pretty interesting. There are also 4 categories of MS. So the first is called relapsing remitting. It's the most common form, and that's usually characterized by flare-ups that are followed by periods of remission. Second category is called secondary progressive. It continues to worsen, and there's no remission or plateaus in progression. The third is called primary progressive MS, and it gradually worsens with some plateaus where things even out a little bit, but it never goes back or has any remission. It's also pretty drug resistant. So the fourth is called progressive relapsing, which is very rare, and it's very progressive with a lot of flare-ups. There aren't plateaus or remissions, so often it's the most aggressive and the worst form of MS. In order to get an MS diagnosis, a patient must have two different lesions in the white matter of their CNS. They must have developed more than 1 month apart to prove that the disease is actually progressing. This can be confirmed through an MRI, and inflammation of the nervous system can be confirmed through cerebral spinal fluid testing. So a patient must also have two different episodes of symptoms to show that there are flare-ups. There are a number of symptoms that can come along with MS, so I'm just going to list them out for you. Leg spasticity, numbness and tingling, pins and needles, especially in the extremities, diplopia, ataxia, vertigo, bladder disturbances. Usually there's incontinence in around 90% of patients. Unilateral numbness from one leg that spreads up and over into the other leg. Trigeminal neuralgia, optic neuritis, and then that can result in complete or partial vision loss. Treating MS is really difficult. There are no FDA-approved drugs that cure or reverse MS, so all we can really do is treat the symptoms. We can use corticosteroids for short-term flares. There are 8 drugs aimed at reducing and slowing inflammation and damage in the nervous system. A number of them even get the immune system involved, like T cells and cytokines, to attack back and slow the progression. There are also a lot of drugs being developed right now, so there is some hope for a cure or at least some better treatments. Also, an option is physical therapy, speech therapy, or occupational therapy. Sadly, there's a lot more about MS that this article didn't cover and that I couldn't get into detail in, so I've included a few more diagrams on this slide for you to look at with more symptoms and treatments. The last topic I want to cover today is repetitive head injury syndrome. You'll find that people who have had concussions run the risk of developing the syndrome later in life, and that's kind of why I chose it. When I was in high school, I got a concussion playing tennis, and my mom was always on my case while I was still having symptoms from the concussion about not getting injured, not going out of my comfort zone when it came to returning to sports or anything like that, because she would always go on about secondary impact or repetitive head injury syndrome, and I was really confused and honestly didn't even think it was real, and now I found it, so it just proves the moms are always right. So repetitive head injury syndrome is obviously not a disease, it's a syndrome, and it's pretty hard to study because there's no way to do a controlled experiment with it. We're mainly seeing it in athletes, people who've had multiple concussions. So really what RHIS is the long-term effects due to multiple head injuries. They can be from repeated concussions over the span of multiple years, or it can be due to a second hit when the symptoms of an initial concussion haven't subsided. There can be varying symptoms when it comes to RHIS. One of these, which is the most traumatic, is called second impact syndrome, where someone is hit in the head a second time while they're still experiencing the first symptoms of a concussion. This can cause bleeding in the brain and can cause so much swelling and inflammation that it leads to death. As the number of impacts increase, which can be over any number of years, these symptoms can become more common. Chronic encephalopathy, longer recovery for future head injuries, increased susceptibility to concussion, dementia at an early age, diplopia, impaired balance, headaches, light and sound sensitivity, abnormal metabolic markers in the brain, which results in reduced cognition, and fun/not fun fact, if you've had 3 concussions, you're 3 times more likely to develop depression. So, how can repetitive head injury syndrome be diagnosed? There are a few ways. You can do an MRI or CT to prove that you've had a concussion or numerous concussions, which can be used to diagnose. Or you can do neuropsychological tests, which test the cognition in the brain and test those metabolic markers to see if your brain is properly functioning. So once someone has been diagnosed with repetitive head injury syndrome, there's not much to do in the way of treatment. You can have physical therapy, occupational therapy, or speech therapy, but nothing can be reversed and the damage has already been done. You can use anti-inflammatories and antipsychotics to help treat the symptoms, central nervous system stimulation, anti-Parkinson's agents, but ultimately, again, the damage has been done and there's no way to reverse it. On the bright side, there's a lot we can do to prevent RHIS. So the first thing, if you're experiencing concussion symptoms or have had a concussion, wait to go do physical activity until a doctor has cleared you and those symptoms have totally subsided. If you suspect you have a concussion, go see a doctor. Beyond that, we can educate athletes and coaches in what a concussion looks like so that we can stop athletes from playing while they're experiencing these symptoms. And overall, I think education is going to be the best thing to do to prevent this from happening. Just like with the other articles, I've included some diagrams here that I couldn't really cover that weren't exactly discussed in the article, some of them being what happens when your neurons are damaged, what the brain looks like with encephalopathy, and then some concussion incidence minimization, so what we can do to prevent this from happening. And that's all I have. Thank you so much for listening to all of this, and I hope you've learned something.